broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to our brief webinar today to mark the release of the draft CBAS waiver amendment. Joining us here today to talk about this big event today is John Shen from the Long-Term Care Division at DHCS, Jeannie Smalley from DHCS, Ed Long, Deputy Director at the Long-Term Care Division at the Department of Aging, and myself, the DPH, the Community-Based Adult Services Branch. So thank you for joining us today. On the agenda, I just want to go over quickly what we have in store today. We are going to overview the waiver comment process and timeline. We shared that with you a couple of weeks ago, but we want to walk through that. It's going to be posted here on our website today. I want to make sure that everybody is clear about what the process for making comments on this document is. And then we're going to walk through and overview the waiver amendment documents themselves, the STCs and SOPs, special terms and conditions, and standards of participation. And then we'll have a question and answer period where we will handle any of the questions that have to do with clarifying things that are in the documents, clarifying what the process is around commenting. So process questions we'll clarify today. We want to make sure that everybody's clear that beyond this webinar today, all of the comments and suggested changes to the documents will need to come through the format that we have put together that is in a SurveyMonkey process we're going to walk through today, that everything that you have in the way of comments and changes will need to come through that process from this point forward. So no comments suggested, please, during the webinar today, but clarifying questions we're happy to entertain today. So that's what we have in store today, just a brief overview of all this process and the new documents. Our objectives, very succinctly, are that we are going to provide a high-level overview, a summary of the waiver amendment, the draft, and to prepare all of you, stakeholders and the public, for the public comment process that is getting started. So what I will do now is to hand it over to Jeannie Smalley, my colleague, and she's going to talk about the waiver amendment timelines, just to make sure you've seen this document before, but she's going to clarify the changes that we've made to this document.
Good afternoon, everyone. We just wanted to update you and let you know that we're staying on course for the waiver amendment timelines. We're now in the April public comment period. We have opened that up for a 2-week comment period, so we've added that to the timeline. We've completed the draft waiver, and that's what we're doing today. So that was in March and April. And after we get the comments, then we'll go ahead and prepare the waiver amendment for submission. So that will be in the month of May. We're hoping to get that into CMS prior to the end of the month. Then we'll go ahead and work with CMS on their request for additional information and clarity. And so we can get the waiver amendment authorized by the September 1 start date after the current waiver expires. So that pretty much sums up the timeline.
Okay, so it's a 2-week timeline now for the public comment, as Jeannie said. So May 8th is the close of business. May 8th is the last day we'll accept any comments through the comment process that we're about to walk through. So kicks off today, ends on the 8th at close of business. That's 14 calendar days for all of you to put together whatever input you have on these documents that we're going to be showing you in a few minutes. So what I want to do now is to take a little time to orient you to where things are on the CBA web page for the documents themselves and for the SurveyMonkey, which is the process that we're going to use for collecting the public comments. So if we can click on this link here and see if we've got it posted. We've been working on Webmaster and everyone else overtime here trying to get everything posted today. So this is where you will find the stakeholder process. If you could maybe expand that out to the whole page, then we can take a look. And while it's loading up, what I want to be able to show you is the new page that we have out on the website that has the documents that you'll need to make public comment, and those are 2 copies of both the special terms and conditions and the standards of participation. The special terms and conditions are the CBAS excerpts to the currently approved waiver, which was amended last for the Managed Long-Term Services and Supports on March 19th. So we have just the CBAS excerpts that are the currently approved copy, and then we have the draft changes to those STCs. So you'll see those there, and then we have the currently approved the standards of participation, which have been posted since December or so of 2011, or I guess April 2012 when CMS approved them. So those go back to the beginning of the program, and then the draft SOPs. So they're both out there for you to look at and compare to see the changes. So you'll need those as you go through the public comment process. And then to the Survey Monkey document itself, I want to show you what you have here is a template for putting input. And so, loading up, great. Okay, so this is what the document looks like. And first, it starts with instructions. First, I want to make sure that you review the documents that we've posted to compile your comments, and want to make sure that you're clear that we're looking for really specific information that will assist us in this in culling all together all the information that you provide us. So a page number for the change that you're suggesting on the revised document, the number that's associated with the STC or SOP, any suggested language that you have, and comments that you have to support that. We ask that you put all that information in there to help us in making sure that we're clear about what it is your feedback is. So the dates are specified again there. Close of business on May 8th would be 5 p.m. And then it also gives you some contact information there if you have some challenges in filling out this document.
And can we just in case we have a comment that some people are stuck on the webinar objectives page, and so I just wanted to see if we can give, the link is on the CBA website.
The stakeholder
under the stakeholder section for CBAS stakeholder.
Yeah, so the same place that we have had throughout the last 6 months, the stakeholder process information. If you go to that CBAS icon on the first page of the CDA website, or you go to the CBAS web page itself and click on stakeholders, you can get to it from there. Okay, so we're going to go back to the slideshow in a minute, but I do want to show you this document just to make sure that if you weren't with us a couple of weeks ago when we talked about this, that you're clear that this is how the process is going to work for public comments. So name and email address and phone number here at the top of the survey format. Those are optional, but those will be helpful if you want to submit them to us so that we know if we have questions we can get in contact with you. And then it's a pretty simple process from here forward. You answer the question, do you have a comment or a proposed revision to one of the special terms and conditions in the document? If yes, then you'll proceed to filling out, like I had indicated, what the number is for the term, what the page number is in the draft, and subsections, whatever will help us orient to where you're having concerns, and then any proposed revised language there in the middle box. And then on the comments box, if you need to put any additional information, you can provide it there. And these are very, very large fields for you to put in information, but if for some reason the language you have takes longer than what we have in these boxes already allocated, then there's an additional comments about the STC's box that you can put comments in down below. And did you have a question?
So Denise, is it one STC per STC number box?
Correct.
And then it can be one page or a range of pages,
it could be a range of
for
pages,
that
absolutely.
STC.
Yeah, and when we flash up the documents, we can talk about this a little bit more specifically. But if you say special term and condition number 95, which is the first one in the document, 95 has multiple subsections and it crosses multiple pages. So if there are multiple things to put in, you can put that here in this
In that
area.
one.
Yes. And so there also is in the instructions that just point your attention to if for some reason you cannot, you have so many comments that you cannot get them into this format. Again, we've given you 6 big boxes with 2 boxes for each STC number there, and then the additional comments box. If you can't fit it, then call us at the number there, and we'll work with you on getting together a format that will work for you. But our objective here is that, that even though we've expanded to a 14-day comment period, that we expect that there will be a lot of feedback, and we want to make this as expeditious a process as we can. So, but call us if you're having problems. We definitely, if you have more to say than we've given you space to say it in, we definitely want to work with you, so call us. Okay, so if you scroll down a little bit further, so that's the STC. Now here's to the standards of participation, a separate document. If you have comments on that, you answer yes, and then again you fill in the standard of participation number, the page number or range of numbers, proposed revised language, and then any comments on that that you may have. So that's pretty much the format. And again, the objective here was not to constrain anybody, but to make this process work for all of us, those of you out there who are going to comment, and those of us on this side who are going to be compiling the comments and reading through them and looking at changing language. This will make it easier on all of us. So thank you for using this process, and let us know if you have some challenges with it. All right,
and just so everyone knows, no one has to make a comment. These are out for your, review, but it's not a requirement for the waiver amendment.
Okay, so we hope there are some of those out there, huh, Jeannie?
Yeah.
Okay, so moving on, what we would like to do now is I'll hand it off to Ed and John, and they're going to do a summary of, a high-level summary of some of the things that have changed and have not changed in these 2 documents that we're talking about today. All right, Ed?
Thanks, Denise. So what we want to do today is just provide you with a high level of a summary, as Denise said, of what does not change from what the current approved version of the STCs and SOPs contain, and then also what we have included as changes to the STCs and SOPs. And I'm just going to walk through them quickly. Again, our purpose today is just to provide you an overview of what you'll see in the posted documents and to leave comments on these changes or lack of changes to the SurveyMonkey process that Denise has outlined. So what doesn't change? Eligibility and medical necessity criteria for CBAS resulting from the settlement agreement have not changed. You won't see a change there. You won't see a change in the eligibility determination being accomplished through face-to-face assessment by the managed care plan or DHCS nurses for fee-for-service. And the managed care plan or DHCS nurses authorizing days per week of attendance based on the periodic assessment of the beneficiary's need. In addition, CBAS providers will continue to be licensed by the Department of Public Health as adult day health care centers and certified by CDA as Medi-Cal providers. CBAS is provided as an outpatient service to eligible Medi-Cal beneficiaries who attend no fewer than 4 hours per day of service at a licensed and certified center. Basic program services continue the same. What does change? And for those of you who listened to or participated directly in or commented on the stakeholder discussions, provisions related to the ADHC to CBAS transition related to enhanced case management and unbundled services are no longer contained in the STCs or referenced in the SOPs. Managed care plans will be allowed flexibility in the eligibility and authorization process. Again, you may recall that there was a discussion that as long as the managed care plan was familiar with the member, that they've done a face-to-face determination at one point in time, but it would not be required again if the plan member had already been assessed or the plan member had known clinical status. Authorization may be up to 12 months based on clinical status of the participant, of the enrollee. Managed care plans will be allowed to contract selectively with CBAS providers. There will be no nonprofit versus for-profit restrictions, and they can contract based on each plan's network, quality, and credentialing standards while ensuring network adequacy and sufficient CBAS capacity within their geographic service area. John, would you like to address the rate?
Yeah. Okay. I think the other thing that changed in the STC, and also a little bit of a change from our discussion at the stakeholder process, is that the administration is allowing the managed care plan to negotiate rate with individual CBAS provider. That kind of negotiation undoubtedly can include the kind of rate setting that is being done right now with an all-inclusive rate per day of attendance, or any other rate structure that include payments, incentive payments to reflect the managed care plan's acuity or level of care needs, to provide quality and performance as well as accessibility of CBAS benefit to plan. That is definitely a change from our discussions in many of our ST's stakeholder process. A lot of our discussion has been focusing on that about the Medi-Cal fee-for-service rate. And that Medi-Cal fee-for-service rate will continue to be published by the Department of Healthcare Services for CBAS participants who are not eligible managed care plan, and will continue to, the fee-for-service rate will apply. But we are providing the flexibility to the managed care plan to negotiate rate in such a way that the managed care plan has the flexibility to work with the provider to set a rate that's reflective of the market conditions, the quality of care, as well as the acuity. I know that in our discussion, we talk about a lot of flexibility for the managed care plan to set a higher rate because a lot of CBAS provider is stepping up to in terms of providing much more comprehensive, much more responsive services to the plan member. And there's a lot of discussion about that. So this is I do remember those conversations in terms of describing what happened normally in the managed care world as well as what happened in the Medicare side of this contracting. Medicare health plans do have a federal requirement of meeting paying no less than what Medicare fee-for-service pay for. In the Medi-Cal world, what we find out since our conversation is that the Medi-Cal plans do not have similar requirements. The Medi-Cal plan do have the flexibility to negotiate rates with provider. In actual practice, most managed care plans for their covered benefits follow Medi-Cal fee-for-service rate or higher. Only in specific circumstances, those rates are negotiated lower because of the local market conditions. What we basically know about the managed care plan negotiation with provider that result in lower rate than the Medi-Cal fee-for-service are really in the arena of durable medical equipment, transportation, as well as pharmacy. But in general, most Medi-Cal plans negotiate rate on the basis of their needs for the members. And I think one thing that needs to be very clear is that managed care plans do have requirements to meet network adequacy. And in the CBAS world, network adequacy means that beneficiaries who need CBAS services are able to be assessed by the managed care plan and able to be placed in services per the timeline that has been operating. So it is managed care plan do have those requirements. Managed care plan also do have requirement to meet continuity of care requirement, meaning that changing from one CBAS provider to another provider or terminating a contract, the plan has responsibility to make sure that CBAS service continue to provide the member if they have been receiving those services. So I just want to make sure that people do understand that the managed care plan do have the flexibility to negotiate rate and not follow the Medi-Cal fee-for-service rate. And that's sort of like a little bit different from our discussion at the stakeholder meeting. And I also want to say it again that in the STC, it will reflect that kind of flexibility. That managed care plan do have a flexibility to negotiate individual rate with the provider, as well as set rates that can be like the current mechanism of all inclusive day rate, or some different combinations of rate mechanism that can be, let's say, for example, cap data rate or rate with incentive payments and so on and so forth. And this is true for CBAS as well as for many, many other providers, the medical provider, hospital provider, and all those providers in the Medi-Cal plan, the plan do have that flexibility. And I think our objective is undoubtedly try to make sure that the CBAS provider and managed care plan can form strong partnership relationships in serving the Medi-Cal beneficiary in the health plan. So, okay.
Thank you, John. In addition to that change related to rates, we're also looking at having within the STC some additional language that describes plan-provider relationships. There was a desire for that that came out of the stakeholder process. And you also see some language that just looks at streamlining the state's oversight and monitoring.
Okay, thanks, Ed. What I'd like to do now is to take a walk through the documents themselves and orient people to some of the changes that we just discussed and how the documents look. So we have the link on the slide number 7 that will take you to the website spot where the documents are posted. And again, there's 2 versions of both the special terms and conditions and the standards of participation. And so that you can look at what's currently approved and what the draft looks like of both of those documents. So if we could pull up the draft special terms and conditions document first, I could just sort of walk through some of the most prominent changes. So the first thing I'd like to draw your attention to is that the currently approved CBAS section of the waiver, it was modified last, actually the whole waiver was modified as of March 19th, 2014, and so the numbers had changed at that time. So the original STC numbers, I think we used to start at 91, we're now at 95. So 95 through 101, we're going to keep those consistent with that version, but the titles have been changed on some of these sections, and many things have been moved around. So as you look through the document for the first time, keep in mind that that we may not have deleted something, but we may have moved it to a different place because it fit differently now in this reorganized document. So under Section 95 now we have the eligibility and delivery system. That was a combining of sections from the original STCs. And right there you will see a lot of things that you're familiar with that have to do with the eligibility criteria that Ed mentioned not changing. If you could scroll down a little bit there. But there are some new things inserted there. Keep scrolling, and you'll see there's the eligibility criteria, much the same as they were before. There might have been a renumbering of some things there. Keep going. There's some clarifying language there, I believe, around eligibility determination under I can't see it. It looks like it's D, under 95D, and there we go, 95D. And then grievances and appeals language that moved from elsewhere in the document. That was one of the things that came up during stakeholders that we wanted to make sure that we we continue to include language around grievances and appeals, even though there are other places in the waiver document that have that information, and other places in the Med-Cal program rules that include that information. But we have kept that. We just moved it from a different section. You keep scrolling. We have STC 96 for an individual plan of care, and some of the things here are the same. It starts with it's the benefit and the individual plan of care. The core services, again in the stakeholder process, we talked about the services not reflecting the actual current CBAS and ADHD statutes. So there's some tweaking of some of the language here for some of the requested stakeholders around core services and additional services. If you scroll down, we get into, keep going, we get into the individual plan of care, and again, some things that came from stakeholders, some discussion about person-centered planning that we inserted there into the language. But the same language you'll see there, again, renumbered, but that includes some of the original components of the IPC. Keep scrolling, and we'll get into IPC, STC 97, where we have some provider specifications. These are very similar to in the original document that has the staffing that are required by the CBAS provider. And then under 98, I just want to call your attention to this is a brand new section of the responsibilities of managed care plans for CBAS benefits. This is where there's some contracting information, as John had mentioned. And this is where we included as well, if you scroll down, a lot of detail on the plan's responsibilities with regards to eligibility processes and authorization, timelines that are elsewhere in statute and in contracts, but through stakeholders we learned that people wanted to make more prominent, so those timelines are inserted there. So that's the new section for provider, for plan responsibilities. And coordination with CBAS providers. So there's some new information in there. All that section is new. STC 99 is where we have some language from the original approved waiver document, but that has been tweaked slightly with regards to oversight, monitoring, and reporting. A lot of reporting requirements consolidated there and made consistent with other quarterly and annual reporting for CMS. And then under STC 100, the quality assurance, again, renumbered and moved and consolidated, but a continuing section for quality assurance and improvement strategy. And then STC 101, where the provider reimbursement that John was just speaking to is listed there, what the fee-for-service, all-inclusive rate is, or not the actual rate, but that is published, and then the managed care plans and how they will have flexibility to reimburse. So that's just a very quick walkthrough of what the document looks like. What you'll notice right away, if you're familiar with either the matrices we were working with during stakeholders or the original document itself, is that it's considerably shorter. There's a lot of information that's not in here that was related to transition, to enhanced case management services related to the transition, and unbundled services which are related to the transition that have been removed, so the document is significantly shorter, and things have been moved around. Okay, so that's the quick walkthrough of the STC document. And if we have any clarifying questions, again, on that document, you can submit in here, but any comments and suggested changes, please bring them, put them to us through the SurveyMonkey process. And now we can look at the draft standards of participation. I'll do another quick review. Did I miss anything, Jean? Let me know.
No, I would just say that with the STCs, if you look at the previous document as compared to the current document, you need to look at the current document in its entirety because we have moved things around, and a lot of things will be in the same wording, but they might have been moved to make more clarity and fit into the new redesign a little bit better.
So, in other words, there won't be a number-to-number correspondence.
Yeah, exactly. Yes, that's correct. And again, when you're giving us feedback, if you do through the survey format, you want to mention what STC is currently under, not the original one, but the draft. We want to have all the comments related back to the draft document. Okay, so the standards of participation. So again, some of the things that you will notice right away is that this document has been is shorter than the currently approved document, and it has been renumbered, relettered, and reorganized. So again, just like Jeannie said about the STCs, make sure that you take a look at the original document and keep reading through the draft to see where things have been moved, because not everything that you don't see in the place that we had it before is related to a deletion. Some things are related to reorganization. So the first thing, letter A, under general provider requirements, this is sort of much of the same intro that we have in the current document, but the major thing that you'll see that's missing here is the provisions for nonprofit provider status restrictions as a specified date. So all that section has been deleted along with that proposed policy. And so section B is now CBAS Center Services. Again, this section was not lettered or numbered before, so in an effort to get everything a corresponding number and letter so we all know what we're referencing, we have put a letter there for you, and not many changes to the actual content, but to reorganizing of that content. Section C now, legal authority and requirements. This is where the statutes are referenced that link the CBAS provider, CBAS centers to the ADHC requirements in law and regulation, and to Medi-Cal policy. And then if you look under section D, we have the physical plant and health and safety requirements that previously were scattered a bit in the document, and now they've been consolidated all here. And there are a couple of new things here, but mostly just reorganization. To keep scrolling down, we have again the space requirements and maintenance. These are all existing information in the standards of participation, but just reordered a bit. Under section E, the eligibility determination and authorization section. This is a newly titled section. It was previously grouped all under one heading, and there's some new information here regarding TARs and reauthorization that's reflective of the flexibility that Ed was talking about with regards to the plans being able to authorize up to 12 months. So that's mentioned here, and then also just references back to the STCs that the providers in this document, which governs the participation of the providers, the references back to things that are specified in the STCs but doesn't duplicate everything. Under section F, individual plan of care, some additional information clarified here around the individual plan of care, but also tied back to the STCs and the IPC requirements that are in the STCs. Section G on CBAS staffing, where we've made a few tweaks, again based on stakeholder input regarding some clarification of things, but the requirements fundamentally remaining the same. Just some clarifying language in there and a renumbering of things. And then section H, where we have moved the majority of things that were organization and administration sort of standards related to standards having to do with organization, and we grouped those all here at the end of the document from where they were originally. This made more sense to us organizationally, things like policies and procedures and sort of infrastructure kinds of things and training. So all of those items are now under the organization and administration section at the end of the document. So again, I just reiterate what Jean said, that if you see something that seems to be missing, make sure you read all the way to the end, because much of what happened in the standards of participation document was about reordering and organizing things in a way that made sense. So that's a very quick walkthrough of some of the changes that you will see immediately when you look at the documents. And I think what we want to do now is start taking a look at some of your questions. Again, if you have questions right now that you want to submit to us that have to do with documents themselves and the process, those kinds of clarifying questions we're happy to take now. If you are eager to get started with giving us comments and suggested changes, you have to do that through the SurveyMonkey process that we just walked through. So questions, Jeannie?
We do have a few questions that I think could add some clarity here. We had, is the waiver to allow CBAS as part of the Medi-Cal benefit permanently? And this process is to allow CBAS to be an ongoing benefit, where right now we're looking at the end date of August 31st. So we are looking for the waiver amendment to add to that timeline beyond the August 31st end date that's currently part of the settlement agreement and part of the waiver that is funding the program. Someone wanted to know how to get copies of this presentation and the slides, and we wanted to make sure that everyone knows that the slides and presentation and the link to the SurveyMonkey for comments is on the CDA website, and that's will be at the end of this presentation, but it's aging.ca.gov, and we have all of the minutes from the previous stakeholder meetings and presentation slides available if anyone wants to review them.
On the stakeholder button.
On the stakeholder button. Will there be any changes with licensing, certification? Is it still aging, or the managed care plans? Do you want to address that?
Let me answer the waiver question. Okay. So again, we explained that the waiver is actually an agreement between the CMS and the State Department of Healthcare Services in implementing the Medi-Cal program. And the waiver has equal weight in terms of contracts between CMS and DHS relate to state plan services. State plan services will be like physician services and hospitals and things like that. And so, but the waiver is really a very significant document that has usually a 5-year lifespan, and most of the Medi-Cal managed care activities and many program activities are actually part of the waiver. So the waiver is not a CBAS specific waiver. CBAS is just one item in the waiver. And this agreement is renewed on a 5-year time cycle basis. The reason that we go with the waiver is that it offers the state and CMS a lot of flexibility in organizing how the service delivery system look like. And I think basically the managed care plan activity are all in the waivers. So just understand that the size of the waiver is not just because of CBAS, but it really relates to all the programs, many of the programs that CMS and DHC agreed to do and provide the flexibility that does not exist in the state plan side. So those, but nevertheless, it's a contract between CMS and the state, and it does have a 5-year renewal cycle, and many things are being updated as the healthcare delivery system changes. Many things are updated in the waivers and changing the waiver, and so it's a, as I said earlier in our stakeholder meeting, this is definitely a living document, living agreement that as the healthcare system changes, the waiver will be changing along. So it's not a permanent set thing, but really something that the state and CMS can use to make sure that we can help the change in the healthcare delivery system.
And I'll take the question about CDAs and the Department of Public Health's continuing role. So the standards of participation and the STCs indicate that the CBAS providers will be required to be licensed adult day healthcare centers. Those are licensed by the Department of Public Health, certified for the Medi-Cal participation by the Department of Aging. So we will continue in those roles. With regards to managed care plans, however, they're the new bosses, as somebody said recently. They are the contracting entities with the CBAS providers. They also have roles and oversight and requirements for the CBAS providers. So managed care plans in your area that you contract with are also in the oversight role in this program.
And managed care contracts are addressed in the STCs as well, and they'll be, the centers will work with managed care plans for those contract renewals. Another question that we can address, will the moratorium on new CBAS ADHD centers be lifted, or if so, do we learn about the requirements for starting new centers? Do you want to address?
Sure. Okay, so the moratorium that was on adult pay health care expired, it was in August of 2012. So there has not been a moratorium in place for some time. However, related to the settlement agreement and the current way that the waiver has been operating for CBAS, there was one application period for CBAS providers, so there was sort of a informal moratorium, and there were no applications being accepted. So once the new waiver goes into place, the waiver amendment, and the settlement expires, we will be developing some kind of a process and criteria for accepting applications. So that we're not there yet, but the moratorium is not in place now, and there's not anticipated to be any new moratorium. But we have yet to develop the process for receiving applications for new centers.
Okay, another one that's a little bit outside the scope here. Now that the CalMedi Connect has started, do you know, or to whom, how we would be able to determine if a member is CalMedi Connect? Do we have any information on CalMedi Connect, or where they would find CalMedi Connect information?
So we're all kind of looking at each other here.
So the question seems to be,
Out of our scope.
do you know, how would you know if a CBAS participant is also participating in CalMedi Connect? Is that the
Right.
question?
Yeah, it sounds like that's what it is, and it sounds like that would be through the usual means, where you're interacting with families, caregivers, the beneficiary themselves about changes that they're making, and the plan. So I'm not sure if there's anything more to that question somebody could send in to clarify, but that's the usual means.
Yeah, the usual means will be probably through the MES system, the medical eligibility system. Basically, people in CalMedi Connect would have a different plan code as compared to in the MLTSS plan. Okay, so I think that's where you will find out whether your CBAS participants is in a CalMedi Connect plan or whether the person is in an MLTSS plan. But for CBAS provider, that's probably slightly, the important thing is to know which plan this person belongs to, whether they are LA Care or whether they are Molina or whether they are, IEHP. I think that's probably more important for you to which plan does your member belong to. That's probably more important information.
Okay, we have, maybe if you can give us a little more clarity, John, on the managed care plans, how their payment is made. We have some questions on the negotiated higher rate for pay and how that could happen, or why that would happen.
I think that this is probably a very long conversation because this is a new environment for CBAS provider. We do understand that, but I think for the purpose of history is basically that when the CBAS first become a managed care plan, when we gone through the transition of CBAS participant into the managed care plan, the plan during that period of time did receive a CBAS specific bump up rate related to the cost of CBAS. Starting July of 2013, we have already incorporated this cost of CBAS in the county in the managed care plan. So there's no specific identifiable CBAS cost to the plan. Basically, the basic concept is that the plan will be receiving a rate that reflective of the cost of the beneficiary or the member in that county. Costs we include everything from nursing home, inpatient hospital, physician, pharmacy, CBAS, IHSS, ambulance, ancillary services like lab diagnostics, those kind of services are all single rate. And I think you can begin to see that in the context of that kind of rate. The managed care plan will have an incentive to purchase community-based value services so that the plan can avoid the cost of inpatient hospitalization or nursing home placement if that's appropriate. So I think the incentive that we're moving towards, we're not there yet. We have different rate cells and all that which have not been aligned fully the incentive yet, but we are getting to a point in the near future, in 2015 and 16, the plan will be paid a fixed rate for their member no matter how frail or disabled the person is, and the plan needs to manage the cost of care and the service of that individual. And that's the context in which CBAS provider will be finding themselves discussing the managed care plan. How can CBAS provider deliver value in such a way that the health plan say, if I want to discharge somebody from the hospital on Friday afternoon, is CBAS a provider there for me? Okay? Same thing with nursing home discharges, the CBAS provider there for me. These are the kind of issues that upcoming meetings we can talk about. I remember in the stakeholder process we do have a large parking lot of outstanding issue of how do we move CBAS forward into the future. And the future is basically that there's financial incentive for managed care plan to buy high quality, high value community-based services so that they don't have to pay for acute care costs or nursing home costs.
Okay, and this question probably adds to your conversation, John. If a provider is not selected for contracting going forward, do they have appeal dispute rights?
I think definitely the managed care plan has provider appeal process. Okay, these are the kind of issues. But definitely the important thing to think about this is really in not so much about appeal and rights, but rather than basically that how are you as a business partner as well as clinical partner to the managed care plan to provide services to CBAS participants who are already in your center.
And I think that's all the questions we have right now, actually. We do have one other question on moving forward with paperwork and if there's any other requirements that will be changing with Department of Aging in that respect.
That's a pretty general question. So I guess I'd just say during the stakeholder process, like John had alluded, we had a long list of items that were sort of future topics or parking lot topics. We've been talking a lot about how once we get through getting our drafts submitted to CMS, we would have more time and be willing to begin work group activities on some of those items. If you want to take a look, if you're not familiar with those items, they're posted on the CDA website under Future Topics behind the Stakeholders tab. So many things that we're going to be getting going on once we're done with the waiver amendment. So I think many of those things are addressed there. And as far as questions and things that people may continue to have, certainly if you flip the slide to our contact information, most people know by now where to find us, or most people know where to find you too, Jeannie. If they don't, they can find you through us. So there's the contact information. You can certainly send questions that you have that you've thought about after today, or that once you start the comment process you can send to our main mailbox there, or to any of your usual contacts at the Department of Aging. So that's what I would just encourage you to do. If you have questions that come up after today, you know where to find all of us.
And again, just emphasizing, as you know, we're on a relatively tight time frame. Our focus is really going to be on trying to respond to questions that have to do with enabling you to comment and submit your comments to us. Although we're interested in other questions you may raise, between now and the time the waiver amendment is approved, we're really going to be focusing on making sure that we do the work necessary to get that done.
Yeah, great. And again, if you have suggestions in addition to on your comment document, you've submitted some language changes, and one of the suggestions you have that you add to the comment box is that you'd like to see us do a webinar on a particular subject. Please feel free to include that information if there's some training needs that people have or further clarification. So with that, I just want to thank everybody for joining us today. Thank everybody for all of your participation up to this point, that got us to this point. And I'll thank you in advance for your public comments that we hope are clear and helpful to us in understanding what needs that you may need us to be responsive to. So thank you again for joining us today, and we'll look forward to getting our work here finished and getting our documents off to CMS in the month of May. Thanks a lot.
Thank you.